Hello, mamas. It's me. It's Maternal Mental Health Month. And remember, you are extremely special. My name is Dr. Dutta. I am a mother. I am a doctor. I am also a mental health ninja because I fight myths around mental health. And this is my YouTube channel. And this particular video is all about maternal mental health. Things that you should know that only mothers suffer from, and these are disorders, these are issues, these are characteristic maternal mental health related woes. Since it's May and we are spreading awareness about mental health, I'll be making quite a few videos on this topic. So stick around, don't forget to like, share, and subscribe. Now, dear mama, this article particularly was about taking care of your mother's mental health and well-being this Mother's Day, because we tend to buy gifts, make cards. What we don't realize is that the nicest, sweetest gift could be to help mama take care of her mental well-being. Because if your mama is doing well, the whole household is doing well, isn't it? Because we are such strong pillars of the family. The commonest issues that mamas go through, especially before they become mamas, also are anxiety before conceiving. It is so rampant and common. So many new mothers to be come up and talk to me about the fact that, will I be a good enough mother? Will I be able to do this? What if this happens? What if that happens? And especially a lot of more millennial moms to be are going through this crisis because they may start conceiving quite late. So the worry that, will everything be okay? What if there is some kind of disorder? How will I manage my work? Because they may have risen to that post, particularly by this time. So there is a lot of anxiety before conceiving for new moms, or moms to be rather. And one of the most common causes for fertility, other than of course biological factors, is stress. And the stress or anxiety before conceiving can cause infertility. So dear mamas, if you are planning a new little tiny member of the family, remember, work on the anxiety with a mental health professional. The second and a very common area where mental health of mothers or mothers to be again suffers is when there are IVF related woes. With infertility, like I said, there could be biological causes of infertility as well. There is always a lot of stigma attached to it. There's shame, there's guilt, there's worry. And along with that, a lot of mothers start experiencing health anxiety, they start experiencing symptoms. And IVF related woes could also be because of the treatment that you're undergoing through, the painful injections. For some mothers, it's just the constant visit to the doctor. Who likes going to the doctor? Not even doctors. So the IVF related woes are another area where usually the IVF centers have a counselor attached with them who particularly does counseling related to this area of expertise for mothers' maternal mental health. Another common area is depression and anxiety during the pregnancy. So you've conceived, congratulations, all things are going well. But if you start experiencing some of these symptoms on most days, if not all days, then definitely speak to a mental health professional. So for depression, if you are feeling low constantly, mentally, physically, no desire to do new activities or activities that you liked earlier, there's a tendency to want to cut off from everybody. There is very poor sleep and appetite, other than the nausea, which may be obviously catering to it as well. Some others get very hyper around the nausea as well. If there is a lot of anger outbursts, if there's too much of snappiness, shortness, constant hopelessness, helplessness, a sense of guilt, and if there are trigger warnings, suicidal ideations in a pregnant mother, you must, I can't emphasize how many must, speak to a mental health professional, please, and your OBGYN who will refer you to one. Anxiety during pregnancy. I have seen mothers anxious in first trimester and the third trimester most commonly. First trimester because the mothers keep on thinking that, will this be fine? Will the pregnancy be fine? And till the major NT scan of the child, is everything okay? And then the second second trimester is considered the honeymoon period where you're like, okay, parking your worries. You're just the right size big and you're enjoying your pregnancy, probably enjoying the eating as well, and the nausea may have settled. The third trimester, a lot of mothers become anxious, where if they keep on having something called Braxton Hicks contraction, they keep thinking they're going into labor, but they're not. They keep on running to the doctor. They keep on feeling anxious. When will the baby come? It's almost like an exam which they just want to get done with, and it's very normal and common. But you can learn relaxation tools. You can learn CBT practices. You can learn ways to be calm during the first, second, and third trimester of pregnancy. So, another place where mental health professionals can guide you and help you. Postpartum blues are fairly common in the first 2 to about 5 days. Some people will go on to like 7, 10 days. Uh, about 80% of women may have it, feeling a sense of disconnect. This isn't my body. What am I doing? How do I take care of a new person? But this disconnect with the child is not very strong. Also, there are no extreme symptoms. For example, in postpartum depression, there's this complete disconnect from the child. You are feeling tearful constantly. You're feeling sad. You may have suicidal ideations, like I said earlier. And this tendency to reject food, sleep goes for a toss, feeling worthless, purposeless. So it's far more in degree in depression. Think of it like common cold versus COVID. Common cold is like postpartum blues, but COVID would be postpartum depression because uh, clearly the degree of distress is a lot more. And for PPD, you must get screened. I'm going to talk more about PPD in one separate video, all about PPD, answering all the questions around PPD. And we're definitely going to dissect more about PPD since it's Maternal Mental Health Month, May. How many M's did I say? Maternal Mental Health Month, May. Yeah, 4. Now, speaking of postpartum psychosis, less common, however, not so uncommon that I shouldn't talk about it. Now, postpartum psychosis could be even a more severe disconnect with the child where you start thinking that the child is not my own, or the child is possessed, or the child is basically, been replaced, imposters. And as a result, postpartum psychosis needs immediate attention by a psychiatrist, immediate intervention by a psychiatrist. No delay should happen. No jhar fook should be done in the cultural context as well. You could do that, but please take them to the psychiatrist as well. It's a humble request. We've lost mothers to postpartum psychosis and babies as well. Rounding up, mothers in general may have PMS and PMDD. Now, what is the difference? PMS is premenstrual syndrome. It's also an older term. Premenstrual dysphoric disorder is the more severe degree of distress. So, the cough, cold, and the COVID example I gave you earlier, PMS is fairly common, whereas PMDD is less common. Having said that, a lot of mamas go through it before pregnancy, after pregnancy, and you should be aware that if your mama is going through these, that give her support, give her hugs, give her gentle kisses. Just tell your mama, Mama, I'm here, right? And finally, mothers have extreme resonance with emptiness syndrome. Fathers do too. I'm not negating that. But mothers, when their children fly off the nest, meaning when they're 18 plus or when they go away for their first stint at college or a job, they really have this sense of void because most mothers, especially in the Indian context, I want to say, have dedicated their life to the upbringing of the children. They may be homemakers, they may have left aside their career just to pursue bringing up children. So, all of these can lead to emptiness syndrome. And finally, menopause. When women hit menopause, which is sometimes in mid 40s, we're seeing early 40s for some women, and late 40s, early 50s, there is another flux of emotions around it. I think I'm going to make a video on menopause as well separately so that women who are going through menopause, they can understand it better and know what they can do from the mental health aspect point of view and things around HRT, etc. So remember, I'm going to make more content around mental health, and it's going to be all short, sweet, and succinct. Just please put in some comments, some questions. Happy to make content around that. And don't forget to give me a shout out on the various other platforms I'm on. My name is Dr. Dutta, and this is me signing off. Happy Maternal Mental Health Day.